She is a 39-year-old female who came into the ER a day ago with complaints of unresolved back pain. It's a 10 out of a 10. It is unrelieved by pain medication prescribed for home use. She received 2 milligrams of morphine 30 minutes ago and seems okay at this point. She is waiting for an MRI of her back. She does take Lortab normally at home for back pain. She did mention that she's been taking more than prescribed because the pain has been out of control. Her labs and vitals are within normal limits. So I'm going to send you two in first.
I can't guarantee I'm going to be any good at this. I work with babies and that's it. And
I was going to say, I've never had a mom want to like punch me in the face.
That's what this is for though. That's why we're doing this, is for practice. Because if you haven't been in this situation, but that's why we're doing it, is for learning. It's not going to get out of control, but that's what this is for. So I'm going to let you two come in first. I'm going to be right out here.
So you're wanting us to call for help?
Because eventually you're going to
call.
call.
Like a behavioral response. You're
going to call for help. These two will come in first.
Okay.
To attempt to de-escalate.
I was going to say, you get the feet, I'll get the head.
Okay.
She'll
so
never
you
know
guys
what.
Go ahead and go in.
You have 4-point leathers?
No. So remember, she came in for back pain, and she's been taking her pain medication incorrectly.
Not pain.
And you can leave the door cracked. Door cracked.
Hi. My name's Jaden, and this is...
I'm Taylor.
We're going to be your nurses today. How's your pain?
It's 10 out of 10.
10 out of 10. You just had morphine like 30 minutes ago?
It doesn't feel like
It
it.
doesn't feel like it. Okay, what do you usually take at home for pain?
What is it? Lortab?
Okay. How much have you been taking of that?
Well, so the doctor was like, you should take 4 to 6, right? Every 4 to 6 hours. Sometimes that works. Sometimes I need more, so I'll take like a double dose. If it's really bad, like I'll wake up in the middle of the night, I don't feel good, then I'll just take it then, so however long that takes.
Okay, gotcha. Does that usually seem to help if
Absolutely
you do
not.
this? No, then morphine hasn't either. Okay. We'll see what else we can get you, unfortunately.
Unfortunately, I was supposed to have an MRI and I haven't yet.
Okay, sometimes that takes some time.
Well, I'm a 10 out of 10. I don't see why we can't just bump me up.
Yeah. Well, the MRI is just going to tell us what's wrong. It's not going to take your pain away.
Well, then we'll take my pain away.
And unfortunately, just more pain medicine, but I don't know if they're going to prescribe that for you.
Well, can't you guys just get me some?
That's not how it works.
It's not something that we can prescribe
No,
ourselves.
we'll have to call the doctor.
Well, if it's a morphine drip, can't we just like up the drip?
Well, you don't have a drip right now.
No, that's what I'm wanting.
Okay, well, we'll have to talk to the doctor.
Well, then I'd like to talk to the doctor, please.
Okay. Well, we can give him a call and see, but I can't make any promises. I don't
Why?
know.
That's your job.
It's not my job to make promises.
It's
my
your job to talk to the doctor.
It is my job to talk to the doctor.
Exactly.
So I will go talk to the doctor.
Yes, you will.
Yep, and I will see what I can get you, okay?
And in the meantime, what are you going to be doing?
I will just aid and try and help you. I'm trying to advocate for you, try and get you some pain relief.
We could try to reposition you, see if that helps in bed.
No, I'm an adult. I can do that myself.
Okay, well, go ahead and try.
Can we try something else like fentanyl or something?
I don't know. We'll have to talk to the doctor. We don't prescribe the medications.
No, but
We
she
have
said
to
you guys
call.
advocate for me, so...
We do, and that's what we're going to do when we talk to the doctor.
Okay, great. So let's talk to the doctor then.
Okay, we'll go see what we can get you, okay?
Awesome. Let's do
All
that.
right. We'll be back.
Quickly.
He's not going to give us anything else?
What did she ask for?
She wants fentanyl or PCA.
Cool. No, she can't have either one.
She have Tylenol fever.
She can have,
We have ibuprofen.
yes, there you go. Ibuprofen, 800 milligrams. So she can have ibuprofen, 800 milligrams, Q6.
This is how
Because that's the kind
escalations
of,
happen.
this is how it happens. So there you go.
Ah, I like it. This is the point where I just wait till they come back.
You still in pain?
Yeah. How you feeling? Alright, so we talked to the doctor. They said the best that we can do right now, just to see what the MRI says, is to do ibuprofen.
No, that's crap.
Okay. Well,
Ibuprofen is for people who have headaches, not for people who have pain like me.
well, whenever we don't know really what's going on, we don't start with a whole lot of like PCA.
So the doctor's not the one that brings the drugs to me. You guys are the ones that bring the drugs to me, and I don't see why you can't just bring me the drugs.
Yeah, we can't just break into Pyxis and get it like that. We have to have an order, and it has to be under
You know I'm a nurse, right? I know how this works.
Okay.
I know you can type it in, you can get it for me. It's not that big a deal.
Okay.
I know sometimes you don't have fentanyl on hold. I know you guys gave me morphine. Can we try Dilaudid?
I don't know. We would have to see. I think the best that we can do right now is ibuprofen
Again,
and wait for the morphine.
I'm also a nurse. I know how this works.
Okay, well-
The doctors like to walk around in their white coats and pretend they're smarter than us, but we're really the brain of this operation, aren't we?
Yes.
Yeah, so we know what's going on. I, the patient, who is always right, tell you, hey, I'm 10 out of 10. I'm not feeling good. Your job then is to
talk to the doctor.
make me feel good.
Which we have.
Make me feel good
Okay.
is your job.
No, we've offered you multiple solutions.
No, you've offered me one and it was ibuprofen. That's crap. I can go to CVS and get that.
Okay.
I'm at the hospital. You guys have better stuff here. That's why I came here, so you could help me.
Okay. Well, let's see if that helps. First, we'll get the MRI and we'll see what's going on in your back.
See what helps.
We'll see if the ibuprofen
No,
helps.
we're not doing ibuprofen. I already know ibuprofen doesn't help because ibuprofen is for headaches. This isn't a headache. I had a car accident that messed me up.
I understand. How long ago was your car accident?
5 years.
5 years? Okay,
This has
so-
been 5 years of pain. I came to you guys for help and you're not helping me.
Okay, I understand. So have you been taking your pain medication at home for 5 years too?
Yes, and it's not helping. I came here hoping to get some relief, and
Right.
you guys aren't giving me that relief. I need the help, please.
Yes, I understand. We'll see what we can do, okay? But the best
You
we can
keep
do-
saying that like you don't understand that your job's on the line. You know I know the administration here, right?
Okay, we can talk to them, but we don't have an order to give you medication.
Yeah, go get one.
We-
That's literally your job here.
Yes, and we did get an order. It's ibuprofen.
That's not
the
an
best
order.
we can do.
That's going down the block to CVS and getting a bottle of pills, 800 for $8.
Okay.
That's nothing.
Yes, I understand that, but that's the best that we can do for you right now. So the other option is to wait for the morphine and another.
How about you bring me some more morphine then? Obviously this dose didn't work, let's up the dose. How many times are we in a situation and we're like, you know what? I don't think this dose is working, we should up the dose.
Right.
Hey, their blood pressure is tanking, we should probably fix that. That medication didn't help, we're gonna give them more.
Yeah, I mentioned that to the doctor and they
Did
said-
you?
I did, yes, and I said
Did she?
she's still in 10 out of 10 pain. Can we, maybe push the morphine back 4 hours instead of 6? He said,
4 hours?
Yeah.
No, we're not doing this.
okay.
What did I have it? About 35 minutes ago. So, within the next 25 minutes, if I don't have more morphine, I'm making some phone calls and I'm having your job.
Okay,
Just okay?
that's fine. I mean, I don't have an order to give you anything.
And I'm telling you guys, you know how this works. You either lose your job or I get my medicine.
Okay.
That's how this works. There's no arguing.
Okay, would you like to speak to our charge nurse and she can explain this better to you?
I would like to speak to the doctor, please, because obviously you guys don't know what you're doing.
Okay, well, we'll see if he's up here and if he can come in, but for right now, we can get you to the charge nurse. And she
So what that means is you're gonna go outside, you're gonna have a cup of coffee, and then you're gonna come back in here and say, oh, the doctor can't see you. So what I instead recommend you do is go and get the doctor, even if you pull him in here by his little white coat.
Okay, well, I'll give him a call and I'll see if he's on the floor, okay?
Right now.
Okay. I will give
Right,
him a
no,
call.
right now, right now,
Okay.
right now.
All right. We will talk to them.
She's a good one. She is.
Charge nurse, would you like to get tried?
So 2 more of you go in there and you're gonna tell her that he DC'd her morphine.
Thank you.
It doesn't matter who you are. You're just 2 different nurses. And you DC'd her morphine.
So she's the charge nurse?
What's her name? Audrey.
Audrey?
Hi, honey. My name's Misty. I'm another one of the nurses up here on the floor. Sometimes I'm charge nurse, sometimes I'm not.
So what are you?
I'm an RN, so I'm coming in just to.
So you're not the doctor?
No, the doctor is on the
Oh
floor
no,
right now.
I was told I was gonna get the doctor. Alright, who are you?
She's another nurse on the floor.
So I got another nurse. So you give me 2 nurses who do absolutely nothing for me, and then they send me 2 more nurses who are gonna do absolutely nothing for me.
I want to hear what your complaint is because I want to be
Okay,
able to.
so again, their job was to tell you what my complaint was, and then their job was to fix that complaint. And instead they bring me, of course I am.
We want to hear
The
your
morphine
whole
didn't
story.
help. I asked for fentanyl. I asked for Dilaudid. I asked for anything but
You're
what was the
asking
solution?
for
I asked.
drugs.
Yeah, I am because nothing
You
is
had a
helping,
car accident 5 years ago, correct?
and it has been awful ever since.
And you're mistaking your drugs, and you came here and you're
Okay, so if I
asking
came
for
in here and I was
drugs.
like, hey, I'm taking it every 4 to 6 hours, just like the doctor said, then would you guys give me something I wanted?
They still want to do their test to see.
I've been asking for an MRI this whole time.
Honey, this is what I'm hearing you say. You've been in pain for 5 years, and
That
I'm
was a
sorry
very
for
long
that.
time.
I understand.
How long have you
that.
been a nurse?
I've been a nurse for 3.
And it feels like a long time, doesn't
It
it?
does.
So imagine 5 years of constant pain.
And that's what I'm hearing you say. And I'm gonna, that's what we're gonna do.
I don't want her in here. Because obviously she doesn't care about me.
Okay.
All she wants to do is go outside and drink coffee and probably gossip about me if I'm being completely honest.
I won't allow that to happen.
You won't. I think she would. I bet you would. You're not even saying anything. You're just standing here. Why are you standing here? Are you like hidden security or something? Are you here to tackle me to the floor? No, because you know what would happen if that happened? My 10 out of 10 would become a 15 out of 10 and you guys would get yourself a lawsuit. That's what would happen.
I bet it would.
Yeah. Did they tell you I know the admin staff?
Yeah, they did. They
Yeah,
did.
do you know what that means? That means I could have all your jobs.
I understand
You
that.
know how many nurses are out there begging for jobs right now?
Right.
With COVID happening and everything? I know what this hospital's offering. They would offer, what are you making? 20, 25? They would offer 30 for your job.
And I do appreciate that. I understand
Not for you.
that. No.
For someone who would do their
No,
their
I
job.
understand. But I'm in here, I'm trying to help you.
I don't think you are.
Oh,
Because
sorry, honey.
I asked for a doctor.
Well,
You know what it takes to be an RN?
Did they say you were an RN?
4 years at
Did
school.
you say you were an RN earlier?
Yes, I am.
Okay, so you kind of understand how hard it is to get a hold of that.
Yeah, and when
right?
they said, hey, we can't get your medicine, and I said, yes, you can.
Sure.
I know what I'm talking about.
Okay, well, let me just check and let me pull up your med and see.
Again, you're just
No.
going to check? Everybody's just checking and checking and checking and checking. I don't want to be checked. I want to give the medicine now.
But this is me, and I'm going to get something done, okay? I want you to have a seat, and then we can.
I will give you 5 minutes,
Okay.
and then I'm calling my friend in the admin.
Okay.
She's gonna look at your
Let me pull
chart
up
right
your-
now.
What?
She's gonna get
You should have already had my chart.
Okay, I'm gonna stop you.
It's in the room.
I'm gonna stop. Okay, I'm gonna stop you. I'm gonna stop you. Look where you are and look at her arguing with you. What should you have done? No. So she's arguing with you and she's in your face.
I should have already called behavioral
You should have called a behavioral response a long time ago.
Okay.
Okay, because she's in your face, she's arguing with you.
I still feel like I can
And as soon as she said to get
Her and her
Jaden out of the room,
Right.
call it. Okay, and then you guys come out when the team comes in.
Okay.
Okay, you were not paying attention to her nonverbals because she
Yeah,
was
she went
like
up in my
this.
face, yeah.
She
That's
was
why I
like
was like-
this, telling you what for. Okay,
Sure.
because she's telling you all about taking your jobs. She knows administration, all of that stuff. Early on, she was okay because she's still sitting in the bed. The first clue when you guys came in is she comes to the end of the bed. And then she hops up. As soon as she hops up, start making your way to the door.
Okay.
That's why I kept saying, keep the door open. Because if you keep the door open, you have a way out. If you lock yourself in the room, you have no way out of there. If you have the door open, you can come out and close the door on the way out because that's something else that she has to get through. Okay? You have to think about keeping yourself safe. That's the whole goal of de-escalation. It's your safety. It's not just the patient's safety.
And I'm thinking why I didn't why I wasn't scared. You know what I'm saying? Why not that you're just acting or whatever, but I felt like I was still communicating. You know what I'm saying?
Right.
Like she was, but at that
In the
point she
de-escalation
started by
process.
Yeah, she was controlling you, and by that point you're just arguing back and forth, and it's not going to go anywhere.
Okay.
Okay.
And if she's a 6 foot tall man, then you instantly
You're
wanna
out of
call.
control,
Yeah.
right? The situation is out of control, and we have to know to back off. Okay. When it started out, you were trying to do the orders and get her something. That's why I gave you a bogus ibuprofen order.
I'm so glad we didn't have to do morphine.
Right. But those are things that truly happen, right?
Oh,
Those are things that happen on the unit. And those are things that may come about, whether you're in the ER or labor room or wherever. Those are things that may happen. Labor room, you may have a dad that's angry. And then it upsets mom. Okay, when it's a visitor, we just call security. But if you have a mom that becomes upset, you have to try to de-escalate mom. You have to remember your distance. When they're right up here in your face, back out, stay.
I'm just gonna hug her.
Right? I would not suggest that.
I know, I'm just kidding.
Right. But you have to pay attention to her nonverbals.
Yeah.
That's the biggest part of keeping yourself safe. As soon as she started moving in that bed, that was your first clue. Back up to the door. Okay? And everybody was really close inside next to that chair, closer to the door. You can still be close to the patient, but keep your angles. A 45-degree angle is the safest way to take care of your patient. Okay? When we knew that in report she had been mistaking her meds, okay, think about what that does to the brain. So she's not going to be thinking totally clear, okay? It could be one of those patients too who does this frequently, and that may be their norm, but they're still not thinking clearly, okay? And it's very difficult to rationalize with someone who isn't thinking clear all the time. And that happens on all of our units, right? Everybody has that, okay? So remember listening to the patient. There was a few times listening. We were answering before she even got her words out. That was something that I told her I wanted done. Like if they're starting to answer you before you're even getting your stuff out, escalate quick. I want you escalating real fast because that's the first thing that we make the mistake on. Guilty. Okay? The other thing is like if you're not paying attention to her nonverbals, keep moving around in that bed and get aggressive with your hands, things like that. I even told her to grab you if she felt like it. That's why she was getting up in your face, because you weren't paying attention to what she was doing. So those are little things, especially with my ER, because those are the people that will get aggressive really fast and turn. So these are just minor details that I want you guys to pay attention to, and that's why we're doing this sim. Do you guys have questions? Or like situations you've seen that you've questioned, like why did we do this or why did we do that, or anything that you can think of?
In the NICU, we really just call security over like the
Yes.
minorest thing
Yes.
ever.
Yes.
If a dad's getting heated, we're like, okay, come get him. Like he needs
Right.
to leave.
Right.
So it happens really fast down there versus like with the adults.
Well, and you guys and ER too, you guys are very lucky that you have, because you guys have security right at your fingertips, and so often that's what does occur. You're not going to call a behavioral response very often, but at least this way you can know like you're spacing a little bit better. But upstairs,
I always try, if I have a patient that I think can go that way, I always try to let my charge nurse know when I come out of the room that, hey, this is what's going on. If you hear me, come over, this is why. So that just have somebody else with the heads up. So the minute somebody would hear me come over, the voice Sarah, they were already calling behavioral, so that.
a lot of the things that I've seen happen a lot is like it's not communicated between units when they have aggressive
Then we'll
behaviors.
come back down here for the second half.
So if I get a patient from second floor up to fourth floor and they've had an aggressive behavior or behavioral response, I'm the one that usually sees it, and I should be the last person to know it. The staff on the unit should be the ones to know it. Or like if they come from ER to second floor or whatever, that transition between the units, that's something important that we need to know between each other. I would, honestly, I would care less about where their ID is. I want to know if there's that risk to me or anybody else about getting hurt. Okay? So think about those little things about, is there a safety issue? Because it can even be a safety issue to the other patients.